Dad, sit down. Hello, thank you everybody for coming today. A few months ago I went to see my doctor for some problems that I've been having. I was tired all the time, I was lightheaded, my thoughts would not stay focused, I was thirsty all the time, hungry. No matter what I did, it never helped. So I went to go see my doctor. He ran some blood tests and determined that I have diabetes. The term diabetes is Latin for sweet urine. It actually means too much sugar is spilled into the body. In the United States, out of the 24 million people that we have, 7.8% are diabetic, according to the American Diabetes Association. 17.9 million are diagnosed, and there is an estimated 5.7 million out there who are undiagnosed. I will be discussing the different types, treatments, and possible causes and effects of the disease. First, let me explain to you how insulin works in the body and the different types of diabetes. Your pancreas's beta cells produce the hormone insulin, which takes the glucose or sugar out of the blood and places it into the muscle cells where it will be used for energy. And then when it's used for energy, it will normalize your blood sugar back to normal to start all over again. When the body does not use the glucose properly, the concentrations become elevated. Dr. Mehmet Oz refers to this as nutritional cocaine. Type 1 is known as insulin-dependent diabetes, also known as juvenile, since it's usually diagnosed in children under the age of 20. It accounts for about 10 to 15% of diabetics, according to Dr. Stephen Edelman, MD, professor at the University of California. These people do not make any insulin. The cells that make insulin are destroyed by autoantibodies. This is when people's immune system destroys their own healthy tissue. People with type 1 diabetes must administer insulin injections or have a pump implanted. Some insulins are fast-acting and some are short-acting. The most common form of diabetes, which accounts for 85 to 90%, according to the American Diabetes Association, is type 2, or otherwise known as non-insulin dependent diabetes. This form is when the cells produce little insulin, or the body cannot use it sufficiently, which is also known as insulin resistance. Treatment for type 2 can include oral medications, diet, exercise, or in worst case scenarios, insulin. Not only are blood sugars important to keep under control in type 2 diabetics, but also blood pressure and cholesterol levels must be checked regularly. At this point, no one really knows the exact cause of diabetes. People are definitely predisposed genetically, but environmental factors are triggers. Surprisingly, cold weather is a trigger for type 1 diabetes. The American Diabetes Association stated that type 1 develops often in colder months in places with colder climates. Another trigger may be viruses. Research also shows that breastfed babies are less likely to develop type 1 diabetes. Most of the cases studied who developed type 1 diabetes were found to have autoantibodies. Again, this is when the body attacks its own healthy tissues. On the other hand, type 2 diabetes has a strong genetic base. As stated by the Genetic Landscape of Diabetes article at the Center for Biotechnology Information, insulin increases many metabolic enzymes, altering them, which affects the messenger RNA on the gene transcription. This is how it's passed down genetically. This is very common in the United States since our diet tends to consist of more fat and cholesterol than the non-westernized diet. These people do not have type 2, even if they have high predispositions. As a result of elevated blood sugars that are not controlled, there are many secondary diseases that are life-threatening. Among these diseases are the diseases of the eye, like glaucoma, retinopathy, and blindness. Furthermore, according to the National Institute of Health, 44% of diabetics have kidney disease. Hypertension accounts for 75% of diabetics. Research also shows that heart disease is 2 to 4 times more likely to cause death in a diabetic than a non-diabetic. This is because that extra sugar in the blood deteriorates the arterial walls, forming holes. Additionally, neuropathy is diagnosed in approximately 60 to 70% of diabetics. This is when the nerve is damaged by the deposits of sugar proteins, which are like crystals forming on the nerve bundles, causing numbness and tingling. This makes it hard for people who have ulcers or burns or infections on their feet or legs to feel the pain, so they don't go to the doctor. And so if it gets left untreated, this can turn into serious infections. And people with diabetes are very prone to infections because the high levels of blood sugar in their body makes their white blood cells not work properly. And a lot of these people will have amputations because their bone gets infected. As a matter of fact, the National Institute of Health says an alarming 60% of diabetics have the below-the-knee amputations. As devastating as these statistics are, there are many choices that we diabetic and metabolically impaired people can make that will change the course of our disease. If you experience continuous signs and symptoms like weight loss, weight gain, excessive thirst, frequent urination, mood swings, blurred vision, hunger, make an appointment with your physician. It literally could make the difference between life and death. Changes in one lifestyle is imperative in fighting this disease. A diet low in carbohydrates, high in fiber, and low in cholesterol is essential. Exercising is also very important. By reducing your weight by just 10%, you will dramatically reduce your risk to any of these secondary diseases. To check your progress, your doctor would order a hemoglobin A1C, which is the 3-month accumulation, an average of your blood sugars. And if you reduce this number just by 1 point, it will reduce your risk for microvascular disease by 40%. Dr. Mehmet Oz and Dr. Roizen put it best in their book, You on a Diet. And I quote, "Diabetes is genetic, but not purely. Lifestyle and behaviors are more dominant than genetics." End of quote. In other words, we may have the gene, but it's our environment that we create that will change the trigger. Okay, thank you.
Very good.
Oh my God.
That was good. You did very good. Very nice.